Ladies and gentlemen, it is now time for the key address. I know it's exciting to network, and there will be a lot of other occasions throughout the day. But if I could please just have your attention for a couple of other minutes, I think we're in for quite some exciting insights from Dr. Brunet. To introduce Dr. Brunet, I'd like to invite Maria Mangiocavallo, Regional Vice President of Commercial Banking for Quebec at Scotiabank, who is once again the official presenter for the 2024 forum. As she joins us on stage, let's take a moment to also watch a brief video from Scotiabank.
Should I do a video about what it's like to be a Chief AI Officer?
That sounds like a great idea. It's a unique and interesting topic.
I'm Yannick Lallemand. I'm the Chief AI Officer for Scotiabank. My job is to find opportunities to use AI at the bank in order to create the best possible experience for our clients. When I was a teen, I read a collection of stories by Isaac Asimov about how robots can become intelligent in the future, and this started a lifelong passion for artificial intelligence. AI is good at simple, repetitive tasks that can be learned from a set of examples. People tend to think AI, like ChatGPT, is smarter than it is because you can speak to it, and therefore you think it's a person, sort of, but really it's not. It's a text generation machine. Unlike ChatGPT, Scotiabank's chatbot uses AI to understand what the customer wants to do, but any answer provided by the chatbot was actually written by a Scotiabanker. AI should be a tool that makes life easy for us. For example, if you've received a text asking you to confirm a transaction, there was probably some AI behind that. Just like with auto industry, AI in banking is a very new technology, but I'm quite sure that in the end, banking will be made simpler thanks to AI.
Good afternoon and bon appétit tout le monde. Thank you for your attention in listening to this episode featuring our very own Scotiabank Chief AI Officer, Dr. Yannick Lallemand, explaining the capabilities of AI, its limitations, and why he believes that AI will make banking simpler. As we saw this morning, AI is changing our world quicker than we can seem to catch up. Yannick would have loved to contribute and be here today and to participate at the forum. However, this is the same week that Scotiabank is hosting its very own AI conference, where the themes embraced over 4 full days include insightful exploration of Scotiabank's Gen AI journey, the innovative approaches used to source groundbreaking ideas, and the diverse families of generative AI and their wide-ranging applications that are transforming industries. On this theme of innovation, it is now my pleasure to introduce our keynote speaker, Dr. Fabrice Brunet. Please bear with me because he has an impressive track record. Dr. Brunet is a pioneering force in healthcare innovation. He is currently serving as President and CEO of the Montreal Health Innovation District, also known as KISS, QIS, and since April 2024 has the Associate Vice-Rector for Health Sciences Development at UQAM. With over 30 years in healthcare, social services, teaching, and research, Dr. Brunet has led transformative projects internationally and is a champion of AI's potential to enhance patient care. Among his accomplishments, Dr. Brunet served 7 impactful years as President and CEO of Centre Hospitalier of the University of Montreal, also known as CHUM, where he oversaw the construction of the new hospital campus, uniting staff and patients from 3 sites in a cutting-edge facility. Prior to this, he directed the Saint Justine University Health Center, even managing both institutions simultaneously for a period of time. Dr. Brunet's leadership spans across Canada, Europe, and beyond, establishing modernized care centers and research hubs and integrating AI to advance hospital management and patient outcomes. His contributions earned him France's prestigious Knight of the Legion of Honor in 2018. His life's work is a remarkable intersection of care, teaching, research, and leadership. And today, he continues to push the boundaries of what healthcare can achieve through innovation. Please join me in welcoming Dr. Fabrice Brunet, a visionary in healthcare and a dedicated advocate for the transformative potential of AI in medicine. Dr. Brunet, the floor is yours.
Carissimi amici, benvenuti a Montreal. Sono lieto e onorato di fare questa presentazione con loro. I will speak English not because I don't want to speak Italian. This is my family native language, but not native, my grandmother native language. Anyway. But I will speak English because there are some people here that don't understand, poor people, Italian. Anyway, so we had a fantastic meeting. This morning we had a lot of insights from very smart people. And it's my pleasure now to explain what we have done here during the last 15 to 17 years and before in Toronto. I come from France, my origin is from Italy, I am a medical doctor, a cardiologist, and I'm also an intensive care physician, so that means that during my whole career I've been dedicated and focused on the most severely ill patients. But recently, I had something that enlightened me, which is we cannot continue to work on disease. We have to better understand how we can keep the population healthy and how we can prevent and reduce disease. That is, for a cardiologist who is also an intensive care physician, a very strange new idea. I also wanted to say that during the last 25 years, I've developed a lot of collaboration with Italian colleagues in research, education, clinical practice, in innovation, and the most recent genius that I've found in Italy is my friend who is here and who gave a fantastic talk this morning, which is Professor Alberto Sanna from Milan. Because when we wanted to move from disease to health management, we needed to have people who have done the same kind of idea for about 15 to 20 years. And we have a lot of things that we can learn from him, and tomorrow he will give a talk at the University of Quebec at Montreal, because we want to learn from him, we want to collaborate on research with the Horizon new program, European program, and he will meet a lot of our researchers. So, that's here, anyway, which is good because I cannot see. Okay, that's good, I can see that. Yeah, I'm good. So, what is the KISS? It's a health innovation district, but it's not only a health innovation district. It's a community. It's a non-profit organization which is a community. That's very important to have this concept of a community of people that you can trust. It's a non-for-profit. We are not a commercial entity, even if some of our members are private companies, and develop their product on the commercial side, but we are just a place, it's going faster than I want to say anyway. And this is an open innovation hub to apply all the innovation to human health, including, of course, illness. I cannot change my mind and become just an healthy... Parlo troppo con le mani, non posso fare tutti, ma... Boh, allora, no, sorry. It's a community based on trust with a multi-sectorial approach connected to a global network. This morning, we talk about how can we make the people and the organization work together. How can we break down the silos? How can we have new projects, new realization that will be the result of all the people that are working together? And this is what the Health Innovation District, the KISS, has as a goal and a mandate. And yesterday we had some of our colleagues from Italy who came and visit us, and they saw what we are doing, and we are eager working with them in the near future. Among all our members, we have different universities, and one of them, which is UQAM. UQAM is the University of Quebec at Montreal. By the way, I'm professor at the University of Montreal and professor at the University HEC. So I'm both in different universities, and my dream is that all the universities will work together to improve the health of the population. It's a dream, but it can become a reality. So UQAM is a French language university, which is a young university. 50 years ago it has been created. We have now plenty of students and professors. I think we have trained as many students that McGill has done, but McGill in 200 years and us only in 50 years. And most of our students are still alive. Anyway, so it's just, I love my friend from McGill University. And then there was, today, one of them, she was fantastic. So we love them. Anyway, the KISS is both a physical neighborhood and a virtual network. It's a physical where you can come and you will be hosted in our hotel. We have a building for hosting the people in our apartment. We have two major buildings for the big companies. This is the big one. You see the one which is fancy, just behind the castle. This is for the rich company. And you have the other one, the brick one. This is for the SMEs. I mean, for the startups and the small companies. But everything is great. We have 2 swimming pools, 2 restaurants. We have everything to make your life happy. Your life happy. Anyway, we have also a digital hub because we are international. We have now more than 15 international hubs working with us for innovating in health and healthcare. And we have a combination of different things, including the metaverse. We have all the work we are doing are aiming at improving the health of the population using creative intelligence, using a shared leadership between the leaders of the community, but also the frontline caregivers. And we have an open innovation ecosystem, as you can see here, which is large, has been built during the last 15 years, is very strong here. We have the same in Toronto, and we have the same in the world. We have also this World International Health Network, which is on 2 different organizations, one which is more than 100 hospitals and healthcare organization, and one which is on 15 health innovation districts. What we want is to create social and economic wealth because, as I said to my friend before, we need money. We need money to continue to develop more and more economy, and we will also commercialize the product, not the KISS, but our members, to give for the healthcare and health systems new incomes and new revenues. We are an opportunity for companies, and we have developed that starting in 2017 with artificial intelligence at the SHUM. In 2017, the SHUM decided to have a corporate strategy for implementing artificial intelligence in all sectors of activities. It's strange, this thing. Huh? It should be Italian, maybe. Anyway. We help all the people, not because he's going fast. So this is the reason why I said it's Italian, because they think fast. Anyway. We are a partner for different companies, and we are inviting companies from Italy to join us when they want to come here. But at this point, I want to stop, and I hope that it will not continue to go further. A couple of weeks ago, I was attending a webinar from New England Journal of Medicine, AI, the new review from New England Journal of Medicine. During this webinar, I don't know if you have attended this webinar, but during this webinar, the patients said, and there were 4 different patients, we don't need medical doctors anymore. We don't need medical doctors anymore. We can access directly to care throughout internet or throughout AI-driven tools. They say that. I'm a medical doctor. I say, well, I've already been replaced. But they also said, if you don't incorporate AI in your practice, we will not come anymore to see you. The Minister Champagne today said, showing his smart watch, we will help ourselves with our health. So, for us today, and it's important for all the people who are in the medical field, we have to understand that we can be replaced. Of course, you will have regulation. Of course, you will have ethical consideration. Of course, you will have all the things, but some countries are not using the same approach. Some companies, the big companies, Minister Champagne also said, you know, Microsoft is developing things in health and healthcare, Apple too. Same with all the other big data companies. So who will be on the other side of your Internet of Things and connected objects? It could be these big companies and not us anymore. It's not a threat, it's a reality today. The patient said that. It was a New England Journal of Medicine AI webinar. It was not just something, you know, that you have on internet with some lunatic speaking. We have to understand that we need to take the place now before we are replaced by this big company. I have nothing against them. I love them. If they give me money, I will be very happy. Because as we said this morning, what I'm talking about is a multi-trillions dollars industry. It's not just a couple of money. It's trillions and trillions of money if we move from disease to health, because there is no limits in terms of innovations that we will use. No limits. Every sector of activities of the humans today can be source of revenue if we consider that we will implement AI-driven tools in their practice. That's very important. So we are at the KISS with all our ecosystem working to design a new system, which is the future of population-based learning health system. It's not a healthcare system. It's a new population-based. That means the needs will be analyzed by AI constantly, and our response will evolve constantly. And for that, we will have the need of a lot of innovation. That is a huge market. So we are going from care to health. And what we are doing today is this one. We are moving from the healthcare system on the left part of the slide to the new one, which is the learning healthcare system. It's not a healthcare, sorry, it's a learning health system that we call the neural network. Why are we calling that the neural network? It's because we need to be directly in contact with the population in a way we are using personalized health to be connected with them and to develop new professionals that we will do with UQAM. UQAM, which is able today to think in terms of health and which is not constrained by health care, because we are not educating and training the health care professional. We are imagining now how we can train the health professional. We call them health architects. And they will be everywhere in all the sector of activity, the bank, the municipalities, the community services, everywhere. We will have now in our decision-making process, the human decision-making process supported by AI, we will see how we can consider the health of the population as a priority. Let's say you are a mayor in a municipality, you want to implant a new, I don't know, a new park or a new plant or whatever. You will have people in your team that say, is it good or not for the health of the population, of your population? If you make this decision, which is based on political or economic purpose, is it also good for your population? If it's not, the population will ask you in a couple of years, why have you done that? And we will train the people, including the population, to do that. And you say, but that will be very difficult. This is why we will use, as my friend Alberto said this morning, the urban living labs. And we have 3 of them around us. One is around UQAM, which is the Quartier Latin. A lot of homelessness, a lot of poverty, a lot of drug addiction, a lot of insecurity. We will completely change the way we will educate the population, work with them, and measure the value in terms of gain of the health of this neighborhood and this population, the same as it has been done in Milan. And that is something we are working on now. We have other here, and we have also in rural, semi-rural, semi-urban here and throughout our network. We have in Copenhagen, we have in Los Angeles, we have in Lyon, and in Milan. So for that, we need to educate and train. And for that, the KISS and UQAM are developing for artificial intelligence a complete new program based on humans, based on data, based also on life sciences research, and also on the multidisciplinary collaborative practice that will help us to respond to the needs of each individual in our population. We have different community of practice, and I don't have the time to speak about all of them, but one of them, for instance, is based on the first 1,000 days of life, and we are working with 4 or 5 of our international network to see how it will be, for instance, in North Carolina, how it will be in Denmark, how it will be in Israel. Israel today is a little bit more difficult, but anyway, we continue to work with them because we think that it's most important to consider what is life, even if there is war, even if there is climate change and all the other things that will threaten us. And this is why we are working with them on this first one. We're also working on the elderly. We are working on how can we, in fact, getting old and add. In fact, we don't want just to add years to life. We want to add life to years and healthy life. And we have researchers working on that with many AI-driven things. We're also working on all the things like mental health in the different environment, like the professional environment. We are using telehealth 4.0. Now we are using metaverse to be really inside the local environment of the people. And we also had one of our community which has been developed to work on what are the effects on extended reality, all sorts of extended reality, including social medias, by the way, and to see the effect, positive and negative, of the metaverse on the health of the population, including the youngster, but also the elderly. So, amici italiani, vogliamo lavorare insieme e aspettiamo tutti di venire qui a Montreal con noi.
Fantastic. Thank you very much, Dr. Brunet, Fabrice. Always a pleasure to hear your inspiring vision and how we can come to make this come to be. As we are wrapping up sort of the conference part of the lunch, just a reminder for the afternoon, the sessions will be starting at 2:40, so please make sure that you enjoy your main course. Dessert and coffee will be offered afterwards in the hall so that they can set up the rooms. And as a reminder, the session on our health, well-being of individuals and communities will be held in this room, so not there, not in the other one, but here. And the session on our territories will be in the room from this morning. The sessions will be at 2:40 sharp, so please be on time so that we can make the best of our time together. Now enjoy your main course and the networking opportunity. Have a great rest of the meal. Thank you.